How to become an NEMT broker. Thinking about becoming an NEMT broker? It's a rewarding career path if you're interested in planning, coordinating, and helping provide transportation for people who need it most. Today, we're covering what brokers actually do, the role they play in the system, and the exact steps to launch your own brokerage. Let's dive in. If this helps, hit like and subscribe. This video is for informational purposes only and does not constitute legal, financial, health, or medical advice. Who is an NEMT broker? NEMT brokers are arguably the most important piece of the transportation puzzle. They schedule trips, coordinate with providers, and secure rides for people who need transportation to healthcare visits. Brokers can be big or small, local or regional, or even national, but they all do the same thing: find and schedule trips. What brokers actually do. Here's how it works. When a Medicaid beneficiary or healthcare facility needs to schedule a trip to an appointment, they call the broker's office. The broker gathers all the details: where the passenger needs to go, where pickup is, what time the appointment is, and what kind of van is needed based on the passenger's mobility situation. The broker then verifies Medicaid eligibility and, if cleared, schedules and confirms the trip request. At this point, the broker reaches out to a provider that services the area where the trip was requested. Once a provider confirms, the broker shares trip details with the customer. And that's just one trip. Brokers handle dozens of trip requests daily. They also help manage trips while they're in progress and confirm everything was completed on time at the correct location. As the need for NEMT continues to grow, there's always demand for more brokers, especially those passionate about embracing new technologies to move the industry forward. The step-by-step process of becoming an NEMT broker. Starting an NEMT brokerage is like starting any other business. The process is straightforward but full of unique challenges. Let's walk through the major steps. Step 1. Scout the field. Evaluate demand. The very first thing any business coach will tell you is to make sure demand actually exists. It doesn't make sense to invest time and money into a business with no customers or one that's fully monopolized by large national players. Evaluate the NEMT business potential by talking to competitors, NEMT providers, healthcare facilities, and current or potential service users. You can educate yourself about the current state and growth prospects in your area with these strategies. Analyze local demographics focusing on populations likely to need medical transportation, seniors, disabled individuals, low-income communities. Review Medicaid enrollment numbers in your region. Assess the current NEMT brokering landscape and identify service gaps where you can step in. Step 2. Devise a solid business plan. Going in blind is a recipe for disaster. Draft a solid business plan for the first 12 to 24 months of operation. Evaluate whether your initial investment and projected earnings will cover your business expenses. Can you reach the break-even point with your own money, or should you consider financing? Account for startup costs like initial licensing and hardware. Factor in ongoing expenses like salaries, marketing, software, and insurance. Be ready for a slow start and always maintain a budget for unexpected expenses. Hardware breakdowns, additional training, new marketing campaigns, things like that. Step 3. Get training and experience. Optional, but smart. Sure, you can jump into NEMT brokering right away, but this trade isn't simple and requires real skills. It might be smart to get training and experience by working for established businesses first. To learn the ropes of routing, scheduling, and billing, start as an employee at a brokerage or transition from related positions like dispatcher or NEMT driver. It's vital to learn the channels for how NEMT brokers get paid and know the rates so you can engage in reasonable price negotiation with future partners. Step 4. Get licensed and insured. Unlike NEMT providers, brokers don't usually need a long list of licenses and certifications in most cases, but there are some requirements you can't avoid. First, registration. Most brokers need a standard business license to operate legally in their area. You'll need to be registered as a sole proprietor or a legal entity like an LLC or corporation to get an EIN, state tax ID, hire employees, and open bank accounts. Second, Medicaid enrollment. If you're working with Medicaid clients or other government-funded programs, you may need additional registration with these entities and submit to audits. Let's be honest, bigger organizations like MotiveCare and MTM often dominate these contracts, but there's no reason to deny your growing business an opportunity to compete. After all, these national brokers also started small back in the 1990s. Third, insurance requirements. Depending on your jurisdiction, you might need commercial general liability insurance, professional liability or errors and omissions coverage, and workers' compensation insurance. Important note, requirements vary by state. Verify state-specific requirements with your state Medicaid agencies, Department of Health Services, and state procurement offices that handle Medicaid transportation contracts. Step 5. Build provider and client databases. The best way to start your journey is by solidifying relationships with people in the industry. Start local, but don't hesitate to reach out to state and federal agencies too. Contact hospitals and doctors' offices who may need help transporting patients to medical appointments. Get in touch with NEMT providers to see if they're looking for new broker partners. You can also seek out private passengers through more efficient marketing channels like social media and local advertising. Any connections you make right off the bat give you a leg up. Once you've formed solid broker-partner relationships, keep a database of all your contacts and make sure they have your information too. And look into NEMT software platforms that make your job simpler and more efficient. The best software on the market offers NEMT broker integration so everyone can easily communicate and stay connected to deliver the best service possible. Step 6. Broker your first trips. Once you've taken all the above steps, it's time to broker your first medical transportation trip. You're just beginning, so don't hesitate to start small to build your reputation. Consider taking smaller commissions and working with less lucrative orders to outbid well-established players. To succeed as an NEMT broker, stay proactive and build strong, lasting relationships with all parties, clients, providers, and healthcare facilities. Keep track of credentialing to prevent fraud. Confirm that passengers are eligible for NEMT service. Ensure all partners are up to date and compliant with regulatory requirements. As the industry grows, stay ahead by analyzing data to improve services, identify trends, and make smarter decisions. Regularly review performance metrics to fine-tune operations for efficiency and better customer service. And keep up continuous marketing and advertising efforts to keep your services visible and attract new clients so your business keeps growing. With the right strategies and tools like broker-oriented NEMT software, you can thrive in this ever-expanding industry. The demand is there. The opportunity is real. Now it's just about taking that first step. That's it for today. If this helped you understand how to become an NEMT broker, hit that like button and subscribe for more industry insights. Interested in exploring RouteGenie's broker capabilities? Scan the QR code on screen or check the links in the description. Don't miss the videos up next. See you in the next one.